Hey, so welcome back. I'm Dr. Hunter and I'm a doctor of physical therapy. And today we have an awesome treat. It's National Breast Cancer Awareness Month. So we get to have an interview with one of our amazing patients. So Miss S, I'm going to ask you a few questions.
Okay.
And then Miss Red,
Yes.
I'm going to ask you a few questions. And then I just want you to just answer them in the best way you want to.
Okay.
She is one of our patients here because I've been having the honor of treating her for her lymphedema. And so we're going to have another video that talks a little bit about a little bit more about how lymphedema sometimes is developed when you have a disruption of your lymph nodes, how your lymph nodes are throughout your body, and then what a physical therapist can do to help you with that situation as far as getting rid of the excessive accumulation of lymphatic fluid in your extremities. So we'll go into that later. But right now it's all about you. So tell me, what is the one thing you wish you knew before you started any of your cancer treatments?
I think, Dr. Hunter, to me, it was how it can affect every area of your life because you're now a cancer patient.
Okay.
And it just changes every aspect, family, your work,
Yes.
your physical appearance, every aspect of your life. I think that's really what I didn't realize at all.
That's so it goes into the next part. This question is, what is the most difficult part of your journey that you've encountered since being diagnosed with cancer, since going through treatment, since being a cancer survivor? What's the most difficult part and how did you overcome it?
I think the most difficult part to me is kind of mental acceptance, because I know that is a big deal, and I never had to think about mentally how I'm going to be prepared for this. So mentally focusing, on God just to get me through the day, through the therapy, and I did overcome it just by exactly that, my quiet time with Him, and that's how I do it.
So you're definitely a Christian.
Yes, ma'am.
In your relationship with Christ.
Absolutely.
That's wonderful.
Absolutely.
Tell me a little bit about how your experience influenced who you are today, the person that you are today after going through all that. How did that experience change it? If in any way it did.
Mm-hmm. Oh, it changed me. Yes. Again, in my daily routine of, I tell my husband, I tell, my friends and my doctor, I don't know how people deal with this, that work full-time jobs and that have young children at home.
Yes.
So I see some blessings in this, and I think that's it. Mainly I'm just blessed for that reason.
That you didn't have as many other things going on during the time.
Mm-hmm. Well, actually I did, and then, when you stop doing lots of activities, like, with your family and with your friends and stuff, because you don't feel good. And
Yes.
You just don't know how to feel better. So where it's important is to continue coming to your appointments, because that helps. Y'all help.
Well, thank you. Thank God for that.
Yeah.
Let me ask you, when it comes to what you're proud of at the end of your journey, because you're a cancer survivor, what is it that you're most proud of and most grateful for?
My family.
Your family.
And the reason why is I continually look back to this journey I had no idea that I was, a cancer patient at 2019. And I had done a mammogram, which she's pushing, get your mammograms, please. I was a single mom and hadn't had one for 9 years.
Oh my goodness.
So I went 2019 and they found a spot.
Okay.
They cleared me because they said it was just, dense breast.
Oh,
so
yes.
2020, I go for my regular routine and my doctor's like, what is this?
Yeah.
And I was diagnosed that day.
Yes.
And within, a month, 3 to 4 weeks, I saw my surgeon. I love her. Dr. Chow is wonderful. She scheduled the surgery, and I had a cruise already paid for. So I said, can I go? And she said yes. So I went on a cruise with my husband and friends in March. And get this, we were the last ship on the seas that could come in when COVID hit.
Right, I was going to say that's
out.
right around the time that they stopped everything.
While we were out,
Yes.
and then we had to stay extra day, and it was, then I'm thinking about this. I'm fixing to have a double vasectomy, and I'm on a cruise ship. I've got to get home. So we got home, and my surgery was on April 1st. So April Fools, it was not. 2020, COVID just kept, giving back, and I think my biggest thing that I'm thankful for is the family that I had, that they came through. Nobody could come around. Right. Nobody, because of COVID. So
that's
my son
very difficult. That's a whole nother situation than many others that are going through cancer treatments or going through it during COVID.
It was sad. It was lonely. It was agony for all these patients. I went to my son dropped me off at 5:00 a.m. and it's ghost town in the house. Have you ever sat at the admissions desk and there's nobody? So when I was prepped for surgery, the nurse looked at me and she, had obviously so much, love for us as patients fixing to have a double mastectomy, and no one there when you get out.
Oh my goodness.
And she said, I'm sorry. And I said, yeah. And so I said, will you pray with me? And so she prays with me and held my hand, and I'm laying there, and my surgeon comes, and I said, can I please spend the night? And she said, you're safer at home. So I had a double mastectomy, 8 drains coming out of me, and I was sent home at 5:00. And my son picked me up, and he and my husband, So my son drained me, for the whole time, 3 times a day. And my husband was there. And I see that because my family came through, but God had COVID. I tell people COVID might have been for me.
Oh my goodness.
Isn't that crazy?
That was a very unique journey, because everyone that goes through this doesn't do it during COVID. Mm-hmm. Let me ask you one other thing, and I think I know the answer. Who helped and supported you the most throughout this journey?
Well, does it have to be one person?
It doesn't have to be one person. It definitely doesn't have to be one person.
I think it was, as I was thinking back on where I'm at today, because I look up and I'm like, is this really my life? And it had to be my doctors, my nurses, and just God giving me the discernment of who to do and who to pick. And that has been perfect. I cannot thank Him enough. So I really think I'm most thankful in this journey for y'all, just helping someone like me who I knew nothing. I'm like, what is lymphedema? What? And I have it. So
yes, and you're so blessed to have so much support, and you're just growing, and the part of the time that I've known you, your village is just strong. Your family, your friends, you guys have a lot of fun, and they love you truly. So, and I mean, it's so easy for me to love you because you're great.
Oh, I love you too so much. So great.
Well, lastly, I just want you to share with us, if you could share something about your story, about your journey, just anything to someone that's out there that maybe just found out today that they're diagnosed with cancer, that may be going through the journey of getting ready for a surgery due to breast cancer, that may be in 1 year of having no cancer. What would you tell someone there listening?
You know what I would say, whether you're a single mom like I was, and then married, going through this journey, is my husband absolutely was a blessing straight from heaven. My friends, obviously, they're my 2 kids, wonderful. But I think what I would say is, number 1, get your mammogram, and the strength comes from the Lord. And if you don't know Him, that is mainly the mission I know that Dr. Hunter and I have, is that you find the Lord, but it is truly strength that you get from Him. And I feel like it was kind of a dream. So you do what the doctors say, you go, keep a smile on your face, and get up, and the strength comes. And you gotta be, I'm not an on-time person, so all these doctor's appointments and stuff, but you've got to push yourself in the strength. Strength comes from the Lord. And after you get your mammogram, if you did get the diagnosis, get a friend, get someone that you can talk to, call us. I know that is something that the mental health people tell me that, that changes your life too. So get the physical and the mental in place and get through it, and you will.
Thank you very
You're
much.
welcome.
Thank you. We'll take a quick break.
Okay.
And you're going to share some things with us?
Yes.
Okay.
I
All
can't
right.
wait.
All right.
One.
Okay, so we're back. We're going to share with you a few items that you'll use sometimes if you are overcoming lymphedema and you want to use something that'll help keep that fluid out. So you have some sleeves. So Miss Red has all the sleeves. She's very fashionable, so she matches everything. So she's going to put one on. And she's going to show you how it goes on her left arm. So it kind of goes on just like as if you're putting on a sock or something. It's not anything that you need to take 30, 40, 50 minutes on. You can normally do it within a minute or less. She's going to put it on her left arm and show you how she does it. A lot of times when you do have lymphedema, one extremity is effective. Sometimes it can be both extremities. It can be one arm, both arms, one leg, or both legs. So that's in place. If you're still having fluid accumulate in your hands, then you'll sometimes need a gauntlet or a glove. And so she has a matching one that also matches her frame. Very, very stylish. And so the gloves or the gauntlets will go over your hands. And that way, if you're accumulating fluid in your hands, you're minimizing that chance of it reaccumulating in your hand as well as your arm. Very good. And you don't have to put them all on, but tell us a little bit about what else you have here.
I'll tell you about what helped me in the beginning, and I again said COVID was for me. I knew that reconstruction was out of the picture because COVID did no elective surgeries.
So when she's saying that, you mean sometimes when you have a double mastectomy, you'll want to right away say, I want to have both breasts reconstructed. So I want a reconstructive surgery.
Correct.
And that was considered cosmetic or non-essential. So
Correct.
it wasn't an option. Okay.
So I had it as an option I was going to do. And actually the surgeon came in to mark me. And I was like, what are you doing here? The plastic surgeon.
Yeah.
He's like, I got to mark you. I'm like, I can't do it. But he said for later. I said, no, I'm good. So no. Obviously, implants or any kind of surgery flap. They had a flap that they, considered. So I had beautiful scars, and I like them. I walk around, just praising the Lord for the scars. But I was at my bone scan, having a scan, and the girl said, because I have prosthetics, and they're wonderful. My lady in Dallas, Women's Boutique,
Yes.
Health Boutique, she, wonderful lady, helped me do, I could be a D if I feel like it, and I could be a double D.
I love that.
So I do love the prosthetics. They're heavy, they're hot sometimes. So the nurse told me about these. These are called nitty titties, if you will. Thank you. Or bosom buddies. I've heard that before. Anyway, this is a crocheted, a lady in San Diego does them for me, and she literally crochets this. She sends them with some of the, what is this called? That
Like the batting, the stuffing kind of.
Right. And this, again, you could be a B, a D, double D, doesn't matter how much stuffing you put in it. So that's up to you. This is how she sends it to me. And what you do is this essentially goes in your bra.
Okay.
I have on like a camisole.
Can I
It
feel
can
one?
go in there. Yes, please. And it can go inside there. Of course, swimming wet. And that's just been a blessing to me. Changed really my whole meaning for how I feel and how I look, because it's easy, it's fast,
Very
it's
natural, very lightweight.
very comfortable. So
How does it compare to a prosthetic in weight?
oh no comparison. You can't even. When you put it on, you can't feel it.
Wonderful.
Yeah. So it can go inside the bra, or it can even go next to the skin and the scar, and it's wonderful. You can't feel it. That's one thing that I didn't want to say I was thankful for my nitty titties, but yeah.
We understand. So very lightweight, very soft, and just another option.
Yeah, exactly. She knits them, her little knitting group knits them and won't let me pay her, of course. So I said, well, I'm going to send a gift of love. So she said, oh, you can do that.
Oh.
So she sends them to me. And so if anybody, seeing this, get a hold of us and, be glad to get you a pair or two. I get million. Then another thing that I was going to share with y'all, as y'all see, I have on the glove and the sleeve for left side. I do have lymphedema over here as well. Was more affected over here, so the lymph system is pretty non-existent. But I do have a few over here. So sometimes I match, sometimes I don't. This is Dr. Hunter's work. She's doing this to move the fluid because it's building up.
Yes.
So this will be away in about, I hope, a week, not a month.
And so what she has on this one, we'll take a little peek, are her short stretch compression garments, which is what we do once we're manually draining, and we put it in place to prevent the fluid from accumulating during the process.
Right. So
that's why this one looks like it's wrapped.
Yes. And then this one is a daily wear. Supposed to wear it 23 out of 24 hours a day. That's because the lymphedema is no joke.
Right, all day. Don't have to sleep in it, but all while you're awake.
Just the day.
Yes.
And it's it's incurable. We have to stay on top of it. I learned that the hard way.
Yes.
It's a maintenance forever, and it's a good maintenance. So I keep a smile on my face, and I'm thankful. It is
very positive.
This life has changed for me. Yes, yeah, but it's good. So here's some different ones of those, Dr. Girl. And look, you can even do.
You can bling it out. Yes.
Different colors, and of course different strengths of the sleeves. And again, it's something that helps you get through your day. You feel better. You can do plain. I do have plain ones. I don't wear them much, but so yeah, I do wear them, and I am thankful for them every day because I know this is a journey that I'm on, and lots of blessings have come out of it already. And the Hunter Professional Therapy place. And come on.
Thank you.
They're so wonderful.
I'm sure you blessed so many with your story. So thank you so much again for your time. I really appreciate this opportunity. Thank you. So like you heard, if you have any questions, please drop us a message. We'll get in contact with you. If you have any questions or concerns about the journey, about the products, about the process, about lymphedema, about the lymph nodes, about cancer, breast cancer, just anything at all, please don't hesitate to reach out to us.
Thank you.
Thank you.
Oh, I love you so much.